when you put ice on the body, you should only and always have at least one layer in between the ice pack or ice bag and your skin. Because what we don't want is a thermal injury where you get in kind of an ice burn of the skin or frostbite, so to speak. Hello there today. If you are watching or listening to us, whether it be on our YouTube channel or on our podcast, I want to welcome you to our deep dive. This is Dr. Jim Hoven, and we are talking today about trauma. And we've talked a lot about trauma through our podcasts and through our Health Matters segments that we've done. And today I wanted to just kind of walk through the trauma process, specifically physical trauma. So we're not going to be talking about mental or emotional trauma today. We've had some really great episodes on that, and we'll be doing some more in the future. But today I wanted to go through what happens after an injury to the tissues, whether it be the soft tissues like muscles and ligaments or to bones, and what happens, what are the common treatments, what do we try at home, when is it time to go into a more basically urgent pattern where we got to look at more invasive types of treatments. And so I want to start by talking about what happens in a trauma. So let's just say you're driving down the street and you stop at a stop sign or stoplight, and then you are careened from behind by another car. What happens to your body? The thing that happens, and this transfers across all kinds of similar traumas. So in other words, you could slip on a snowboard and hit your head on the ground. You could be in a sport and take a bad hit and fall. So any number of things, it's going to be a very similar physiological reaction, even though the mechanism of injury could be vastly different. When the body undergoes trauma, there are certain physiological and mechanical things that happen. And it starts with the soft tissues. So the muscles in the area of trauma, and to use our example of being hit from behind in a vehicle, it's going to cause the head to travel backward. And that means that the front neck muscles are going to get stretched. And when they get stretched, if their ability to overcome or compensate to the force being applied to them, in other words, to that head going back, lengthening those anterior or front cervical muscles, if it's not up to the task compared to the amount of stress in the system, then those tissues are going to start to basically think of it as tearing. Now we're going to grade that in a 3-grade system, grade 1, grade 2, grade 3, which means a grade 1 is a slight strain. We've all heard about the strain injury. A grade 2 is a moderate, and a grade 3 is a severe strain, all the way up to a muscle tear. And so when we have these types of traumas, the first level of defense is our muscular system. And when those muscles get strained, again, regardless of the body part, same mechanism of response, the muscles are going to try to compensate, try to protect, but they go through some stretching damage. Then the next thing we need to look at is the ligaments that are around the joints close to the area. Again, to use the neck, it would be the joints in the neck. There's 7 of them. They're called cervical vertebrae with facet joints. Those joints would then be taxed through an extension or a head going back range and then whipped back forward in a flexion motion. And when that happens, the ligament doesn't have time to react, and the muscles are overpowered with the force that's come into the system. And so the ligament then gets stretched. Well, just like a muscle can get stretched in 3 grades, so can a ligament, where we can have a grade 1 mild ligament sprain, grade 2 ligament sprain, which is moderate, and a grade 3, which is a severe ligament sprain, which can be a ligament tear as well. So we've talked about the first 2 primary features physiologically from any kind of trauma, which is the muscles and the ligaments. Now, obviously, the bones can be involved too. So if we get something that falls on us, or we kick something with our foot or punch something with our hand, that can affect the bones and you can get a fracture. And there are so many kinds of fractures. We don't need to go through all of them in this video. But the fracture then is a breaking of the bone. So we look at those 3 basic tissues, and there's a lot more things that go on around these, but just for the sake of the nature of this video, we'll talk about those 3 things predominantly. So let's say the injuries happened. Now we're suffering from some soft tissue damage and a ligament issue, and maybe a bone bruise, and so we'll not even say a fracture at this point. What do you do? Well, most of us don't want to necessarily go to the hospital right away. Now, if the injury is severe enough, of course, we're going to go to the hospital, because these traumas can be incredibly challenging to treat, and they can have long-term ramifications or consequences on our body in the months, years, and decades to come. So if you ever undergo an extensive or even what seems to be an insignificant trauma, it's critically important that you get checked out by a qualified healthcare provider. But until that time, what can you do at home to manage? Because sometimes someone will go through an injury, a traumatic injury, even sometimes a mild traumatic brain injury where they might have a little headache and they might feel a little disoriented from either bumping their head or repeated heading of a soccer ball or any number of things. And so they're like, oh, I don't think it's bad enough to go to the doctor. So what are some things that are commonly done to get relief from minor, and I repeat, minor traumas at home? First, you can think of the RICE concept. RICE, R-I-C-E, stands for rest, ice, compression, and elevation. Now, this predominantly applies to extremities, to your legs and ankles and feet and hands and all that kind of thing, where you can wrap that area with something tight like an ace bandage, or you can put different types of tape on it if someone that you're working with, or you have that skill set to understand what that particular process is. Or you can get different braces and that kind of thing. That will put compression on the area. But then we also want to make sure we get that R component, rest. When something has been damaged, when there's been trauma introduced to any part of the body, it's really important that you rest it in order for the cells inside the tissues, inside the ligaments, that they can start healing, and that takes time. See, when the body goes through a traumatic event, and you start getting tearing of ligaments and or muscles, you're going to get an inflammation response, which means you're going to get all of these chemicals that the brain produces to say, hey, we need to get some help out there. So they're going to come down, and you're going to notice that you get swelling. So for example, if you sprain your ankle, you look down and it's going to be, depending on the degree or level of sprain, it's going to get swollen and it's going to be very stiff and sore and a lack of range of motion. All of that happens because the body's attempting to stabilize that ankle, to stabilize that joint. Same thing happens in our spine, only we can't see the swelling as dramatically as we can in the ankle. But around that injured area, around the torn muscle tissue, around the torn or sprained ligament, you're going to get a lot of swelling so that the body can't move as much. And when it can't move as much, that splints it. It's a natural kind of splint to protect it and allow healing to take place. So we've talked about rest to allow that cycle to work through. We've talked about compression, which is putting something to kind of hold pressure on that injured area. Then ice. Ice is a great tool. Now, there is some thought where people say, hey, I've used heat on an acute injury and it tends to really work great for me. There's also another school of thought of something called contrast. We've talked about these before on separate videos where you go ice, heat, and I'm a big fan of contrast. But in the RICE analogy, or not analogy, but in that acronym, that I is for icing. And what icing does is when you put it on an injured area, it's meant to decrease swelling and act as an analgesic. What is an analgesic? It's something that basically makes you feel less pain. So a few tips on ice. When you put ice on the body, you should only and always have at least one layer in between the ice pack or ice bag and your skin. Because what we don't want is a thermal injury where you get in kind of an ice burn of the skin or frostbite, so to speak. So you want to put something, at least one layer in there. And once you start the feeling or you get the sensation of cold, then you want to time that for about 10 minutes. And you don't want to hold that on there any longer than it feeling numb. If you start feeling a numbing sensation on whatever part of the body you've applied the ice, it's time to take it off. Now, again, I'm a big fan of contrast. So if you're doing contrast along with the ice means you're going to add heat into it, then I like moist heat. And you can use a hot towel that you get wet and then put in a microwave. Just be really careful because that towel can be smoking hot coming out. So you want to wrap that with another towel, but that moist heat tends to get a little bit deeper and it helps now with increased blood flow. So if we have increased swelling, we don't necessarily want to bring more increased blood flow. So by doing a contrast, ice, heat, ice, we're going to get analgesic and decrease swelling. Then by putting that heat on for 10 minutes, moist heat, we're going to bring that back into the area because new blood flow means new healing chemicals that are coming from the blood to help with the healing. And then we end with ice and then we push that out again. So that's contrast therapy. And the E in our formula for RICE is elevation. Elevation just means trying to get your limb up higher. And again, if we're talking about a neck, it doesn't really make sense of, I'm going to elevate my neck and elevate my head. So this is predominantly, again, if it's wrist, elbow, knee, ankle, of getting that up to a higher level. And that just allows for a better circulation to move some of the injured, they're called metabolites, move them through the system, allow for better blood flow, better circulation. So that is rice. So another thing that people will do at home in order to help when they've had an injury is to make sure that they are actually writing down. You might be saying, well, how does this help? It's super helpful that you write down in a pain journal exactly what you're feeling. So if you just write down like, oh, sprained my ankle and it feels like it's really blown up on the left side and it's a sharp stabbing pain whenever I put weight down and it's worse in the morning, like just describing what's happening. And then if you look at that day to day and you're not finding ways that thing is getting better or different, that's a really, really clear indication that you need to get something checked out. Because ideally, after trauma, depending on the severity of the trauma, we should start noticing improvements relatively quickly, either in range of motion or in swelling or in bruising or in pain levels. Something should be changing after the first just couple of days to few days, again, depending on how bad the trauma is. So keeping this pain journal, you can even rate the pain on a scale of 10 and you can say, wow, my ankle today, if 9 or 10 means I need to go to the hospital, my ankle today is a 4. And is it a 4 the next day? Okay, well, then there's a little decreased swelling, a little increased bruising. My range of motion feels a little bit better. I slept okay, or the pain kept me up at night. All these different things are what's going to determine how this healing is going. Now, again, from the doctor side of my perspective, I'm always about any injury that you have. If you have access to someone who knows how to evaluate that thoroughly, professionally, accurately, you should get that done as soon as possible, because if there are things that can be done to help you heal faster and more completely, that's going to prevent you from re-experiencing potentially the same injury down the road with maybe even less stress. For example, I've had an ankle injury in the past, and so my ankle is a little bit weaker on one side. Well, yesterday I was walking on a sidewalk and I just kind of missed it, and I sprained my ankle. It literally just happened to me yesterday. And because I have the ability through the stuff I have at my house, I could get it taken care of. I could get my ankle adjusted by someone in a very, very easy, gentle way. I could put a special kind of tape on it called kinesiology tape, could do therapy on it. And it's so much better today because I had access to those tools. Now, had I not, my swelling would have been increased, my range of motion would have been decreased, definitely would have had more bruising and all that kind of thing. So I could have kind of gone through the cycle, but it's really important that we start looking at those kinds of things and then documenting them through a pain journal. So I won't go too deep into what more home things you can do other than saying this. If you can look at after trauma for a period of several weeks after trauma, getting your inflammation down in your system, it really helps. And the main way that we can do that is by trying to eat anti-inflammatory foods. So less of our refined carbohydrates, less on the real fatty proteins, things that drive inflammation in the body. If you can cut those out for a handful of weeks, you're going to notice that your body heals faster. Also increasing your water intake, because the more dehydrated we are, the more concentrated some of this stuff gets, and it becomes harder to push the bad chemicals or bad metabolites out of the injured area. Also, look at anti-inflammatory natural substances. So you've got things like bromelain, trypsin, chymotrypsin, these proteolytic enzyme groups. And you can look those up online or go to a health food store. They'll tell you all about that. Fish oil is another great anti-inflammatory, but it takes time for that to get into your system. So all of those are things that you can do on your own in order to try to help with the inflammation process, which then speeds up the healing process. So we've talked about what to do at home. Let's just say that now you need to go to the next level, and you're not big on medication, and you certainly don't want to go see a medical doctor if you don't want medication. What are some things that people commonly do for these types of injuries? Well, one is they will go see their massage therapist, their physical therapist, their chiropractor, their acupuncturist, and all of these come at trauma from a different angle. But what I found is when a person receives a variety of treatments from these different disciplines, things go really well. And you'll find that some of these folks will have a multitude of modalities at their disposal that are adjuncts to what they do. For example, as a chiropractor, in our clinics, when I was running clinics, we would have massage therapists, we would have physical therapists, we would have e-stim machines, electrical stimulation, and we would bring all of these things together so that the patient could get things that push out swelling, like the electrical stim and acupuncture. We'd have acupuncturists, and that would help push out swelling and decrease pain. And then as they got better, we would include more of the manipulation from the chiropractic side, and then we would include the physical therapy exercise to rebuild that area so that it wasn't so susceptible to a trauma next time from even less stress. That's how we did it. Some clinics don't have that kind of a setup, so you might have to find a couple different ways, or you might find that something works better for you individually than another. But again, massage therapists are going to do a great job of trying to work the muscles around the injured area. And if it's too acute, in other words, if it's too new, if it's too swollen, if it's too painful, they're not going to be pushing on all those muscles. They're going to be working on muscles around and away from that site to try to use what's called lymphatic drainage to move circulation through the system and then allow for healing to take place indirectly. They, like also a lot of chiropractors, a lot of physical therapists, some acupuncturists, they'll use tape as well. It's called kinesio tape. There's lots of different brands. I like Rock Tape. That's my brand of choice. And you'll put tape over these swollen and inflamed areas. And when done in a very specific way, the tape will actually pull the swelling out into the lymphatic system. So a lot of these providers will combine some sort of electrostim modality, acupuncture, again, distal soft tissue work along with taping, and maybe even along with very small amounts of motion just to get things moving. So not full range of motion exercises, but rather really abbreviated high rep ranges, maybe up to 50 to 75, real small range of motion repetitions to just get the nervous system and the circulatory system moving. So those are some basic things. Now, as to kind of go a little bit into the chiropractic side, when a chiropractor manipulates or what we call adjusts a joint, what we're doing is a lot of times you'll hear this popping sound, and that's called cavitation. Some people call it gapping of a joint. And what that does at one level is it really resets a lot of the joint mechanics, the proprioceptors. It brings motion into those joints, which is very healing to the body. But it also has a neurological effect above and below where the joint is adjusted. So that's why chiropractors can seemingly get amazing response without necessarily doing all the extra stuff. And they can get great responses on things like traumatic-based headaches and neck pain and back pain and all that stuff. My particular philosophy is I like to try to affect those mechano or proprioceptors, same thing. I like to affect those in multiple dimensions. So I love to adjust the spine, but then and the extremities, but I also love to do the soft tissue work and the taping because there are these receptors in all of those tissues, in the skin, in the muscles, and in the joints. So my preferred way is to try to introduce stimulus in all three of those areas, the joint, the skin, and the muscle. And I've just found that's what works best for me. And then, of course, adding in acupuncture to help with the energetic side of things and these specific nerve points has been ridiculously effective. Soft tissue work through, like we talked about, with whether it be muscular exercises or whether it be through soft tissue work, powerful stuff. So whether you get a group of providers that do these things, or you go into a clinic that has different therapists that do them, or you find one or two that work best for you, that's something that you'll notice, you'll find as you test these out. But I highly recommend that you try some of these conservative care methods unless the trauma is major. Because let's face it, if you're driving down the street, you're on a motorcycle, you fall off or get hit on the motorcycle, something happens and you fracture your arm and your arm is sticking out, your arm bone is sticking out from the skin. You don't want any conservative care. You don't want to just be taking vitamins. You don't want the RICE. You need to get to a hospital and you need a surgery. So at the end of the day, trauma is graded mild, moderate, or severe. And in the cases of severe trauma, sometimes we need to look at more, we'll call them aggressive or possibly invasive procedures. So if someone has a fracture, they need to have that fracture either splinted or reset, depending, or surgically pinned. All of those are possibilities on a bone fracture, depending what bone, how bad it's fractured, where it's fractured, all those kinds of things. We also look at things that are more along that continuum of more aggressive as different kinds of injections. So people get steroid injections, they can get epidurals to try to calm down pain around nerve roots in the spine. They can get saline or other injections into muscles for trigger points. There's a lot of different things that these specialized doctors called physiatrists or pain management doctors do, combined with sometimes medications as well. So that moves down the spectrum, or I guess you could say up the spectrum of intensity for treating traumatic-based injuries. And again, the key is understanding what is the type of trauma that I've had. Is it mild, moderate, or severe? And have I had previous traumas before? Because if you have had previous traumas in the same area, more than likely you are more susceptible to a more severe injury given the same stimulus. In other words, if I roll my ankle like I did yesterday, if I've had many previous ankle injuries that I have not rehabbed, I have not taken care of, I'm more susceptible for a more severe, potentially more severe, and an easier injury from the same exact thing than happened 1 or 2 or 3 times ago. So multiple episodes of the same or similar condition or symptom is really considered a high complicating factor for healing. Another example, if you have whiplash or concussion, a great example of concussion. If you've had a head injury that's led to a mild traumatic brain injury or concussion, and you don't get that completely healed, and you experience another trauma, even if it's not as significant or severe, there's a very high likelihood that you're going to experience another concussion, and they become cumulative, and it starts to have a more deleterious effect on your overall health. So these are some of the things that I wanted to just bring up today in our deep dive about trauma. And to summarize it, decide, is it mild, moderate, or severe? And if you're going to look to treat it conservatively at home, if you're going to look at getting conservative care at a provider's office, or if you need to go to more aggressive care, and then working through the plan. The thing that you want to make sure you avoid is doing nothing. Doing nothing to trauma injuries is a bad idea because, again, that physiology will adapt to get more scar tissue, to have binding up in what's called the fascial system. So you'll have this gunk in there that won't allow as good a movement, and it becomes more highly innervated, which means it's more sensitive to pain. And so taking care of injuries and not letting them turn into old or chronic or potentially permanent injuries, that should be your focus whenever you undergo trauma. So I hope that was helpful. If you have any questions, you can reach me. You can email me, Jim, Jim, at ramoslaw.com. And also, if you have ideas for topics or things that you'd like us to do a little deeper dive on, please email and let me know. And I hope you found this helpful. And if you did, please, would you do me a personal favor and share it with someone who might be going through a trauma, or if it's a coach or someone in a sports team that they have typical traumas, whether it be football or gymnastics or soccer or hockey, these kinds of things. Maybe this would be beneficial for them as well. But overall, we just really, really want to make a difference in any way we can. So thanks for the time. I appreciate it. And I wish you well and hope you get out there and keep making a difference in everything you do.